So imagine a person named Red who just moves to a new country, doesn't speak the language, ends up getting sick and needs medical care. If this were you, who would you trust to help you seek care? So that's where community health workers, or CHWs, come in. They help people navigate the very complex healthcare system that we have. They're trusted members and also usually come from the communities that they serve. And that gives them a very deep and unique understanding of local needs. But despite the amazing work that they do, they often experience low pay, lack of recognition, and also burnout. And there's not a lot of research out there or data that tells us why this is happening or how to change it. So my research, called the CHW Voices Study, fills in that gap. So we actually interviewed CHWs and supervisors across Colorado to understand how challenges and systemic inequities like racism, discrimination, and power dynamics affect their personal lives and also their professional work. So why does this even matter? So if you think about a forest ecosystem, right? If a tree is struggling, you can't only look at its leaves. You have to look at the soil, the branches, who's coming in and out of the forest, and its entire environment. We also have to look beneath the surface, so the roots, the root causes. And in my research and results, we learn strategies and recommendations from CHWs directly on things that they want to address, like more trainings and career growth, and also a workplace that truly values work-life balance and empathy. And these are just a few things to name. And so why does this all matter? And it's important, these results are important because it helps us inform and guide CHW programs, research, and policies to improve the workforce. And so remember the person named Red in the beginning? So that's actually my mom. And those were her experiences when we first immigrated to the US, not knowing where to access care, where to get it, who to even trust. And so just like my mom, there's people out there who still struggle to navigate the very complex healthcare system that we have. And it's not their fault, but they would benefit so much by working with CHWs. And so supporting CHWs also mean that you're supporting the patients, the clients, the communities that they serve and are a part of. And so just by listening to the voices and including the voices of CHWs, we can let researchers, other healthcare professionals, policymakers, and letting them know how to support the workforce and to be able to transform and change the public health systems as a whole so that CHWs, the communities they serve, and the communities that you care about can truly thrive.